Dr. Lee, can you tell us about sealants? Who should have them? Is it only children? Is it also adults? And are they really preventing cavities the way they say? And does everybody need them?
Sealants, all kids should get sealants on their molars and even some of the premolars, the smaller teeth towards the front of the mouth, if they have really deep grooves in their teeth. If they have shallow grooves and they're able to clean them, they don't necessarily need sealants, but most kids don't really brush too well, so it's a good preventive aid.
How does one determine whether a kid has shallow grooves or not? Does the parent see that?
No. Most parents aren't really they're not aware of what the anatomy of a tooth should be like. So you should go to your dentist and have them take a look. If you have a shallow grooves in your teeth, the sealant probably won't even stay in there. We only do the sealants on those deep grooves to help prevent them because the toothbrush bristle, it's so thick. It's thick enough so it can't get into those really tiny crevices. So we fill those crevices up so you can brush a lot easier.
So basically the groove is too small for the toothbrush go in, but big enough for the bacteria, the rests of food to stick in there.
Right. Bacteria is microscopic, so it can get in anywhere it wants to. It can get through your skin, it can get into those grooves. Even our adult patients that have those deep grooves, and we see that they have a dietary high intake of sugar, and we start to see a lot of staining in and around their grooves, we might recommend they get sealants also, because getting a little liquid hardened up and put into your tooth is a lot better than having to get a shot and drill your tooth later. So prevention is always key.
Sure. And how long do those sealants last? And and then they're gonna get replaced like constantly or so? Is that how it goes?
Sealants usually last, there's a lot of factors, but sealants may last for about, 3 years or so. But we see adults where they've had their sealants for over 20 years. If you have a really hard, crunchy, sticky diet, you're going to probably pull those sealants out faster. If you have a diet where you eat a lot more sugar, those sealants will probably fall out faster. It just really depends on our patients, and sometimes also how the sealants are placed. We make sure that we place them so they're going to stay in their best. But there's a lot of factors beyond our control.
Sure. It is a body. It doesn't grow, like a machine. It grows not symmetric. All right. So sealant is a good thing. People, kids should do it as soon as their teeth develop. The second one, and not on the first one, I assume, right?
No. We don't seal baby teeth.
Yeah.
There's no real need to.
Because they kind of keep growing anyway. It would probably fall out anyway, right, or something.
Yeah.
All right. Good. Well, wonderful. So let's get the sealants. Let's get the sealants done, I guess. Anything else on the sealants? Did I interrupt you on something?
No. Again, in general, like I said, we might not seal baby teeth, but if we see that, in a special case, they might be really prone to getting decay, or they're starting to get a lot of decay. We still don't want to let those baby teeth go. We might end up sealing them once in a rare while. Those baby teeth, some of them need to be in there till the kid's about 12 years old. So, we don't want those teeth to start breaking down too early. So, it's another one of those things. It's not a cookie cutter kind of answer. Every patient is different, and for each patient, we're going to recommend what's best for them.
In matter of fact, you just mentioned something important. I think, like the baby teeth should be staying in. Like when I grew up, nobody paid attention to the baby teeth staying. A baby tooth got bad, you pulled it. In fact, my father pulled at least a couple, if not more, right himself. Literally. You understand? Because, it gets loose anyway, just bang, out it goes. I remember him putting a, little thread around and with the door, he made fun out of it. The fact is they pulled them out. But in the meantime, I have heard that I might have been lucky, I never needed braces, but by doing so and not balancing that, having the teeth stay in as long as they need and yet coming out not too late either, in case your orthodontic bill might go way higher, or if you do it right, you might even avoid an orthodontic bill in the first place. Is that true?
Right. Yeah. So, baby teeth, if the dentist will evaluate the patient properly, there's sometimes baby teeth need to be taken out earlier, just to allow the permanent teeth to come out straight. Sometimes the baby teeth need to be kept in there, or we might need to use other devices to keep the space open so the permanent teeth can come out and not get crowded. Both situations are important. If you have a tooth that's starting to come out in the wrong direction because it's not positioned properly, baby teeth might need to come out early, and your dentist should properly evaluate that by taking a look at the X-rays and seeing how things are coming out. We have patients when they're 15 years old, they still have a baby tooth, but their tooth is out to the side, the permanent one, because that permanent tooth never came out the way it should have come out. So just proper evaluation is really key.
So maintaining the baby teeth is important in order to get the second set, the permanent set of teeth coming in straight.
Yes. Yeah. If we had to take out a baby tooth prematurely, we always want to make sure we maintain that space so the permanent tooth has enough room to come out.
All right. Thank you very much, Dr. Lee.